Arteriosclerosis, atherosclerosis. Arteriosclerosis and atherosclerosis are in some cases used to mean exactly the same thing, however there's a contrast between the two terms. Arteriosclerosis happens when the veins that convey oxygen and supplements from your heart to the remainder of your body, courses, become thick and hardened, now and again limiting bloodstream to your organs and tissues. Sound conduits are adaptable and versatile, however after some time, the dividers in your supply routes can solidify, a condition ordinarily called solidifying of the corridors. Atherosclerosis is a particular sort of arteriosclerosis. Atherosclerosis is the development of fats, cholesterol and different substances in and on your conduit dividers. This development is called plaque. The plaque can make your courses limited, obstructing bloodstream. The plaque can likewise explode, prompting a blood coagulation. Despite the fact that atherosclerosis is frequently viewed as a heart issue, it can influence veins anyplace in your body. Atherosclerosis can be dealt with. Sound way of life propensities can assist with forestalling atherosclerosis. Side effects. Gentle atherosclerosis ordinarily doesn't have any manifestations. You ordinarily will not have atherosclerosis indications until a vein is so limited or stopped up that it can't supply sufficient blood to your organs and tissues. Here and there a blood coagulation totally impedes bloodstream, or even falls to pieces and can trigger a coronary episode or stroke. Manifestations of moderate to serious atherosclerosis rely upon which courses are influenced. For instance, on the off chance that you have atherosclerosis in your heart courses, you may have manifestations, for example, chest torment or pressing factor, angina. On the off chance that you have atherosclerosis in the corridors prompting your mind, you may have signs and indications like unexpected deadness or shortcoming in your arms or legs, trouble talking or slurred discourse, impermanent loss of vision in one eye, or hanging muscles in your face. These sign a transient ischemic assault, TIA, which, whenever left untreated, may advance to a stroke. In the event that you have atherosclerosis in the corridors in your arms and legs, you may have signs or indications of fringe conduit illness, for example, leg torment when strolling, claudication, or diminished pulse in an influenced appendage. On the off chance that you have atherosclerosis in the supply routes prompting your kidneys, you foster hypertension or kidney disappointment. When to see a specialist. On the off chance that you think you have atherosclerosis, converse with your PCP. Likewise focus on early side effects of deficient bloodstream, for example, chest torment, angina, leg torment or deadness. Early determination and therapy can prevent atherosclerosis from deteriorating and forestall a respiratory failure, stroke or another health-related crisis. Causes. Atherosclerosis is a lethargic, reformist infection that may start as right on time as adolescence. Albeit the specific reason is obscure, atherosclerosis may begin with harm or injury to the internal layer of a conduit. The harm might be brought about by hypertension, elevated cholesterol, high fatty substances, a kind of fat, lipid, in your blood, smoking and different wellsprings of tobacco, insulin obstruction, corpulence or diabetes, aggravation from an obscure reason or from sicknesses like joint pain, lupus, psoriasis or incendiary entrail infection. When the inward mass of a corridor is harmed, platelets and different substances regularly cluster at the injury site and develop in the internal covering of the supply route. Over the long haul, greasy stores, plaque, made of cholesterol and other cell items additionally develop at the injury site and solidify, narrowing your conduits. The organs and tissues associated with the hindered corridors then, at that point don't get sufficient blood to work appropriately. At last, bits of the greasy stores may sever and enter your circulatory system. Furthermore, the smooth coating of the plaque may burst, spilling cholesterol and different substances into your circulatory system. This may cause a blood coagulation, which can impede the bloodstream to a particular piece of your body, for example, happens when obstructed bloodstream to your heart causes a coronary failure. A blood coagulation can likewise make a trip to different pieces of your body, impeding stream to another organ. Hazard factors. Solidifying of the corridors happens over the long run. Other than maturing, Factors that may expand your danger of atherosclerosis include hypertension, elevated cholesterol, undeniable degrees of C-reactive protein, CRP, a marker of aggravation, diabetes, corpulence, rest apnea, smoking and other tobacco use, a family background of early coronary illness, absence of activity, an unfortunate eating regimen, confusions. The difficulties of atherosclerosis rely upon which conduits are impeded. For instance, coronary supply route infection. At the point when atherosclerosis limits the courses near your heart, you may foster coronary supply route infection, which can cause chest torment, angina, a coronary failure or cardiovascular breakdown. Carotid corridor illness. At the point when atherosclerosis limits the courses near your mind, you may foster carotid vein sickness, which can cause a transient ischemic assault, TIA, or stroke. Fringe course illness. At the point when atherosclerosis limits the veins in your arms or legs, you may foster flow issues in your arms and legs called fringe corridor sickness. This can make you less touchy to warmth and cool, expanding your danger of consumes or frostbite. In uncommon cases, helpless course in your arms or legs can cause tissue demise, gangrene. Aneurysms. Atherosclerosis can likewise cause aneurysms, a genuine complexity that can happen any place in your body. An aneurysm is a lump in the mass of your conduit. A great many people with aneurysms have no side effects. Agony and pulsating in the space of an aneurysm may happen and is a health-related crisis. On the off chance that an aneurysm explodes, you may confront dangerous interior dying. Albeit this is normally an unexpected, calamitous occasion, a sluggish break is conceivable. On the off chance that a blood coagulation inside an aneurysm unsticks, it's anything but a vein at some far-off point. Constant kidney illness. Atherosclerosis can cause the corridors prompting your kidneys to limit, keeping oxygenated blood from contacting them. Over the long haul, this can influence your kidney work, holding waste back from leaving your body. Anticipation. A similar solid way of life change is prescribed to treat atherosclerosis, additionally assist with forestalling it. These include stopping smoking, eating quality food varieties, practicing routinely, keeping a solid weight, checking and keeping a solid pulse, checking and keeping up with solid cholesterol and glucose levels. Simply make sure to make transforms slowly and carefully, and remember what way of life changes are reasonable for you over the long haul.